I've been joined by Professor Sutton, Chief Health Officer, who has to go at 12:30 for AHPPC, so bear that in mind, and Jerome Weimar, the COVID Response Commander. So currently there are 68 active cases of the coronavirus in Victoria, both in hotel quarantine and resulting from the current outbreak. There has been one locally acquired case overnight in today's report. This is a primary close contact for someone who has been isolating throughout their infectious period. This new case is linked to the Maidstone care outbreak, but I stress is not a resident. A new single case already in quarantine, which this case is a positive sign. However, just like the one day that we've had of 0 cases on Friday, this case in quarantine is a good thing, but it cannot be taken as mission accomplished. There is still more work to do. There are more people to interview, there are more leads to explore, and we have the need to make sure more Victorians get tested. Testing numbers increased yesterday to just over 17,000, and I want to thank everyone who continues to come forward with even the slightest suggestion of symptoms. However, we still would like to see those numbers higher. Those numbers higher gives our public health team the intelligence and the information as to where this virus is circulating in our community. That sort of rapid information and rapid response is the most powerful weapon in the public health arsenal against this outbreak. To track down those last few leads is the most important thing we can do. And I stress that if you've got the slightest of symptoms, please come forward to the more than 200 test sites right around the state that can give you a very quick turnaround in your test results. We saw in the case announced yesterday an individual who had symptoms, how that person immediately got tested and within a few hours had returned a positive result. After a comprehensive interview, a number of exposure sites were established, verified and published over the course of yesterday. And I encourage everyone to familiarise themselves with those exposure sites that have been listed over the last day and a bit. And I'll just go through some of the key sites and allow our Auslan interpreter to move along at that pace. Some of these sites, or all these sites, have been located in areas including Reservoir, South Bank, Docklands, North Melbourne, North Geelong, Thomastown, Thornbury, Craigieburn, Burnside, Hillside, Taylor's Hill and Taylor's Lake. Some of these stretch back a number of weeks, and that's about our public health team now looking upstream for acquisition sources in some of the more recent cases that have been identified, and making sure that we run down those branches of the outbreaks, particularly the Kappa outbreak that we've identified during the course of this outbreak. Turning to vaccines, our numbers today for yesterday stand at 14,319 vaccines, which is a strong set of numbers for a Saturday on a weekend, and add to that as to what Victorians more broadly have done, we now stand at 1.7 million doses across the state's clinics, the GP practices and the Commonwealth's program. This caps off another pretty strong week of Victorians coming forward to receive their first doses, including, I note, the Premier of Victoria. And these return doses will be variously booked in when it comes to particularly the Pfizer vaccine in between 3 to 6 weeks for their second dose, as advised by the Australian Technical Advisory Group on Immunisation. I think I pointed out yesterday that some 50,000 people have already booked in for their first dose of Pfizer in the coming week, and that's a very strong figure. That's the number of first new doses we can administer as we also continue to maintain booking people in for that important second dose, where we have tens of thousands of Victorians booked in for that. I can confirm that every first dose booking already in the system for this week is well and truly locked in. New appointments for both first and second doses are coming online all the time, and we actively monitor the available appointments to make sure that people can get an appointment that matches their appointment for the particular type of vaccine they're receiving. We are monitoring second dose compliance very carefully, and we are pleased that Commonwealth's own analysis that they've shared with us for data from the Australian Immunisation Register indicates that over 88% of Victorians have had their second dose within the recommended timeframe. And we're continuing to work very closely with the Commonwealth on this vaccine rollout program, which has clearly stepped up a few gears in recent weeks, because we want to make sure that we match that huge demand with the limited supply in the way in which continues to deliver the rollout within the constraints of the ATAGI framework that has been set for the timing and the delivery. We are very grateful for everyone who has come forward to get the vaccine as they've fallen eligible. Those who have called up, lined up and taken that important step to protect themselves, their family, their friends and their community from this virus. Because the truth is we are still living with this virus for some time to come. We're also grateful for everyone in metropolitan Melbourne for following those rules to keep us safe, and I might just ask Jerome to expand on some of the details about the operational side of things, and then we're happy to take questions. Thanks.
Thank you, Minister, and good afternoon. It's been a solid 24 hours in the response to the outbreak, of course underpinned by 17,710 negative test results that came through yesterday, which we're very pleased about. That now makes almost 6.9 million COVID tests that we've now taken as Victorians, and I think it highlights that we collectively know how to respond to these outbreaks, and we know as Victorians how to go get tested and to support one another to get tested over the days and weeks to come. It is so important that we sustain those high testing levels so we can be sure we've tracked any remote traces of this virus still circulating in our community. With regards to the Kappa outbreak, of course we have one new case today, but it is a day 13 test of an existing R-Care primary close contact, so again well within the boundaries of our expectations, and again it highlights the importance of the work that our primary close contacts do in isolating so strongly and ensuring that any late detection of the virus is still contained when they're in their quarantine period. So that means we now have 3/4 of our primary close contacts who have now been cleared, 6,400 primary close contacts cleared and released from their quarantine period. We have just under 2,000 primary close contacts left across the wider Kappa and Delta outbreaks. Across that wider Kappa outbreak, we've talked about the city of Whittlesea, we've talked about Port Melbourne, we've talked about R-Care, we've talked about the reservoir cases recently, and of course the two individuals who travelled to Queensland. There are multiple connections across those different branches of the Kappa outbreak. I won't go through them all again. I think we've done that over the last few days, but we are seeing a very clear picture of how that cluster is unfolding, and the only case today being a day 13 test of the existing R-Care primary close contacts is an encouraging sign. In terms of Delta outbreak, no developments there, which I'm pleased to say, so we continue to watch that one very closely, and obviously very keen to ensure that anybody else who's remotely exposed to any of the exposure sites the Minister's gone through and on our website, we please ask you to come forward and get tested. The number of exposure sites continues to reduce, but please, again, this is one of our last few opportunities to make sure we really pull up anybody who may have been exposed within these exposure sites, given the transmission we've seen at some of those locations. And finally, with regard to vaccine, of course, we continue to take both second dose bookings in particular. Our real focus now is around ensuring that those who are coming up for their second dose of Pfizer, we have over half of the people who are coming due in the next week for their second dose at the 3-week mark. Half of them are already booked in, and of course we encourage the remaining people to continue to book in for their appointments over the weeks ahead. And with that, noting that Brett has to leave shortly, Chief Health Officer, Minister and I will take any questions.
We got genomics back for yesterday's case. Have we confirmed that it's part of the CAPA?
No, not yet, Rachel. So we obviously we're seeing there's one linkage we're very one close linkage we're exploring between that positive case and other parts of the CAPA outbreak. We should have genomics back later on tonight or tomorrow. I will confirm that then.
Thank you. We have a number of mystery cases in these few outbreaks. Testing has been quite low in the 15 to 17,000. What's underpinning your confidence in easing the current, what has underpinned your confidence in easing the restrictions that we're currently in at the moment?
Certainly, as Joanne said, we're clearing all of those thousands of primary close contacts. We're going through hundreds every day, and we've worked through two-thirds of those. With all of those new cases emerging really in those who are in quarantine, that's very encouraging. That said, we're still seeing the odd case who has not been identified as a primary close contact. So you're right, the testing numbers, even though in relative terms they're pretty strong, there's something like a 10 or 15 minute wait time across almost all of the 200 sites at the moment, and so people should feel absolutely confident that they can get through quickly, easily, get a test almost anywhere across Metro Melbourne or wider Victoria and get that result within 24 hours almost certainly. There are a couple of areas that have been affected by the storms out in the Far East, Belgrave, Lilydale, but Ferntree Gully, Baronia, testing sites are still available and operating. So still an encouragement for people to get tested at the very first sign, but obviously all of those, several new cases in recent days who've already been in quarantine and no new exposure sites associated with them is a really good sign.
So you're not overly worried about the few mystery cases we've had over the past few weeks?
We're working through some of those mystery cases, and some of them have moderately established links, not absolutely definitive, but a pretty good sign that they're linked. The genomics tells us even more that they're the Kappa variant for some of them. And so, it's really the very early case after the Wallet case and the index case for the Arcare outbreak that remain the real mystery, if you like. Most others have lines of investigation, haven't been tied up in full, but pretty clearly linked with all likelihood to existing cases.
We have had 6 cases that we've been unable to find the source for, even though we know where it came from weeks ago. 3 of those have been this week. How worried are you given that this isn't over, particularly given that we went into lockdown on the basis of 2 of those unknown source cases, essentially?
Yeah, look, it's fair to say we didn't go into lockdown on the basis of just mystery cases. Mystery cases are a concern. They do relate to the fact that there are other cases out there that haven't been identified and therefore can't be chased down from a contact tracing point of view. Some of those mystery cases in recent days, as I say, we're in the process of working through those investigations, and there are some early signs of likely links. We want to work through all of that other information, double and triple checking the exact times and locations, CCTV and other electronic data that might assist in terms of the exact crossover periods. But, it is not over yet, and certainly we want that high level of testing to be able to give that assurance about any other cases that might be out there.
And just on those 2 Queensland cases, that was of course announced by Queensland at 3:30 last Wednesday. 4:21 p.m. New South Wales had a list of possible exposure sites up. I understand that there were authorities in 3 states that wanted to talk to these people, but it took until Friday afternoon for Victoria to list exposure sites for these people. Is that good enough, and why a 48-hour delay?
It was literally the earliest we could get that information. Queensland were undergoing those initial interviews. That was already late into the day. New South Wales the same. that couple were not available to us for interview at that time.
For 48 hours?
No, the information that we could get in terms of the exposure sites were available at that point in time. That was the earliest access that we had for that detailed information. And so, you know, we couldn't have gone any faster in terms of digging down to that data. Would have loved it straight away. They were not in our jurisdiction, and you know, the primacy and priority for Queensland Health and New South Wales Health is the you know, the possibility that that couple were infectious with all of those exposure sites in those two states that both Queensland and New South Wales needed to know about. We are basically working as to where they might have acquired it in Victoria. So it was less of an issue about active exposure sites. That said, you know, we want that information as soon as possible, just like everyone else.
And have we got any clues as to where they might have got any more?
As I say, we're working through that. We haven't definitively linked it, but we're reasonably confident about that acquisition. Some of those exposure sites, and I put it in inverted commas, do actually relate to where they might have gotten it themselves. That means that there was an infectious person at those exposure sites. So it's an exposure site in the sense that transmission may well have occurred at one of those sites.
And is the Craigieburn Central still a live option, or have you gone off that?
No, still a live option, but we've probably got better leads at the moment.
And Queensland Chief Health Officer Jeanette Young, last week she had said that she had assumed or presumed that the couple were most infectious in Victoria. Has that possibility been completely discounted?
Certainly they were at the tail end of their illness when they were diagnosed in Queensland. An illness might be, you know, 4 or 5 days, but when you're just picking up viral fragments in very low doses, it's likely that it's been, you know, 10 or more days since they were infectious. So it certainly brings them back to potentially infectious period in Victoria. That said, we were in our lockdown and some limited movements at the time that they were most likely infectious, but there are still those acquisition sites that we're concerned about.
And how worried are you about the current testing rates, and what kind of an impact will current testing rates of about 15 to 17,000 have an impact on your decision to advise whether or not to ease further restrictions?
Look, it's not going to be the be-all and end-all. I just encourage everyone, you know, we're going through winter, there are lots of coughs and colds about. Please don't assume that it's not COVID. People have been surprised by their own positive results because they hadn't been identified as a primary close contact, didn't regard themselves at risk, didn't regard themselves as having gone to an exposure site, but nonetheless ended up with COVID. Nobody wants to have inadvertently put others at risk because they've had COVID and not had that diagnosis. So just huge encouragement to everyone with runny nose, sore throat, headache, fever, cough, to just go and get that test, get it turned around, and have a result very quickly, because that will, you know, give us even more confidence that there's nothing else out there that we don't know about.
Just on restrictions easing, do you foresee that there'll be crowds allowed at the AFL games that are scheduled for next week?
I think it's pretty early to say in relation to that. I haven't received formal advice for next week in relation to major events, but it's pretty early on to know with respect to the MCG.
There are games, 2 in Melbourne, 1 in Cardinia Park in Geelong. Could there possibly be different restrictions?
There's a possibility, yeah. We'll look at that, but they need to be individually assessed on their merits.
And in terms of the next set of, or the next stage of restrictions that are set to be eased, you know, not asking for a time frame, but what do you expect the next easing of restrictions to look like?
You know, we'll work that out as we go. I think we've flagged that there will be, you know, we're on track for more easing in regional Victoria, and the same for metropolitan Melbourne. Exactly what that will look like to be determined. We want to make those as minimal as possible, and the closer you are to that declaration, if you like, the greater the confidence you can have that that's an appropriate and fulsome step that you can take. So we are on track for further easing, which is a great sign.
Professor Sutton, are kids likely to be able to go back to swimming lessons and ballet classes with the next easing of restrictions?
All in the mix of considerations, yeah, nothing to announce today.
Yeah, the reason I ask is because there was a small group of dancers in the city this morning saying we just don't understand why we can go to school and be in a classroom with 30 other kids, but I can't go to my ballet class where there's only 2 or 3 of us in a...
Yeah, look, there are so many considerations around all of this. We understand the criticality of school and what it means for kids to come back together face to face. All those other settings will be assessed on their merits, but you have to understand, what the risk is for each and every one of those by virtue of how people interact indoors, how long, whether they can wear masks, etc. So, we're all doing it tough as Victorians, but we have to take those graduated steps, as every established community outbreak in Australia has done. They haven't just snapped back to everything back to normal. They have worked through graduated easing to make sure that it's done safely.
Is it safe to say that the allowing home visits will be one of the last restrictions to be eased?
I wouldn't jump to that. I think, again, we need to consider what it means as a cumulative risk when people are allowed to move between households. But, we also know that people are doing the right thing. They are getting tested early. They are isolating until they get that negative result. So, if you're not symptomatic, you're moving between households, that's manageable, and we'll look at those considerations through this week as well, obviously.
And just on wearing masks outdoors, there have been a few epidemiologists over the last 48 hours who've been critical of that and said that they don't think it's necessary. How cognisant, when you put that rule in, were you of the fact that if you make rules too tough, people start ignoring them?
I don't see people ignoring rules. I see Melburnians and Victorians doing the right thing with masks, as they've always done. But yes, we don't want to inappropriately fatigue people or make people think that any particular element is really excessive. We are in a critical phase right now. We need to run this to the ground, and the international experience through the whole last 16 months is that a lot of governments, a lot of public health officials have underestimated this virus or have acted too late. We're in a situation in Australia where we've beaten this back so many times successfully that, of course, we feel confident and comfortable that we can do it again. I would just say we can't assume that we're not vulnerable or that the challenge isn't really substantial, especially with a Delta and a Kappa variant. And we've managed Alpha, and we've managed the original wild-type virus, but these variants of concern remain challenging, and we cannot not win. We have to be successful against them.
Is that up for consideration this week?
Yeah, of course it is. Everything is. Yeah. Well, I think I might need to go. Thank you all.
Can I ask Mr. Weinreich? What's the need for the restricting of access to Pfizer at the moment? Can you explain that to us, please?
Yes, I mean we're given a certain allocation of Pfizer by the Commonwealth from the national, as part of the national programme, and we're very pleased about that. We delivered around, I think, 100,000 or so doses of Pfizer last week. We're heading now into, as we said yesterday, so over the next 3 weeks we're heading into a significant surge of people who are now eligible to get their second dose of Pfizer from that big growth we had 2 or 3 weeks ago. So in the week ahead there'll be about 50,000 people who will now have their 3-week from their first dose, so they'll be able to get vaccinated. Half of them have booked in already, which is great. The other 25,000 we'd encourage to start making their booking for next week or the week after. The national guidelines are 3 to 6 weeks for your second dose, and we'd encourage people to plan ahead and to book their doses in.
Are you likely to be able to obtain any extra supplies to try to meet this demand?
Well, no. Look, we've got sufficient supply, and look, we're tight. So we're running the vaccination program as hard as we possibly can to give as many people as possible access to both the AstraZeneca and Pfizer vaccine. We have enough supply to ensure that people who are due to get their second doses in that 3 to 6 week window will get their second doses. That does mean, of course, that we've held aside booking slots, booking appointments across our vaccination clinics for people to get their second doses. It does mean people, of course, need to book them in to make use of them, and there's no rush for that, but we would encourage people who, if you haven't booked in your second dose yet and you've had your first dose of Pfizer, please book it in. And we will hold back the number of first doses we can do to make sure the second doses do get done on time within the capacity of the supply that we have.
Are you expecting this long weekend might result in a sort of a slowdown of some of the...
Look, I don't think we'll slow down overall. So, I mean, as I said, last week we did 95,000 or so Pfizer doses. I'm expecting in the week ahead we'll do a similar number of Pfizer doses across first dose and second dose. And certainly over the next 3 weeks, we're expecting to run at around 90,000, 95,000 a week or so. That's within the supply lines that we've got from the Commonwealth. I'm expecting to use every single dose that I can. It does, of course, mean that for those Victorians who've had their first dose of Pfizer, if you're due to get your second dose in the next 3 weeks, we'd really like you to book them in so we can get you done.
What's the advice for Pfizer second doses? If you wait too long, is the second jab less effective? Or
Yeah, I can't comment on that. That's a question for the Chief Health Officer. Certainly, the ATAGI guidelines that we follow are that the second dose can be any point between 3 to 6 weeks after the first dose, and that's what we program into our vaccination program.
A lot of people have complained that it was too difficult to book in for a second dose of the Pfizer. So have you simplified that process, and will people be able to actually call and make that booking now?
So absolutely. So people who've had their first dose of Pfizer, if you haven't got a booking yet for your second dose, you can call the contact centre today or tomorrow or any time over the next few days and get that second dose booked in. And we checked again this morning with the contact centre. We've got 1,000 people there sitting on the phones. And look, absolutely. 2 or 3 weeks ago there was a real rush of people trying to get first doses in. It is a lot quieter on the contact centre now, so I'd encourage people to look at your diary, decide when you want to go and have your dose, and be willing to be a bit flexible. We will get you in that 3 to 6 week window. We've got 48 clinics offering Pfizer across the state, so we'll find a way of getting you through.
Are you holding off on the first round or the first shots of Pfizer?
Look, I certainly can. We're reducing. We're able to deliver 95,000 doses of Pfizer across first and second dose every single week. So that's the capacity we have. That's the supply we have from the Commonwealth, and we're keen to use all of that. As we get to a larger number of second doses coming due in the next 3 weeks, there'll be fewer first dose appointments available. That said, I've got 50,000 appointments already booked in for next week for first doses. They will all get done.
A couple of weeks ago, the government were testing an online booking system. Any news on when we can expect that to be an option for booking?
Yeah, so certainly we've got, we're well into the final testing for the online booking portal, and when we have an announcement to make about that being available, we'll make it. What was that?
Yes.
Just on the COVID-specific legislation that the government is negotiating with the crossbench, can you walk us through that, please?
Yes, I can. So I saw those reports that I must point out were made public in March when the legislation that extended the current arrangements till December, we indicated publicly, and in fact we reported in our monthly report to members of the Legislative Council that we would work through how we go from a state of emergency generalist position that links this pandemic response at the moment is to the same set of circumstances as bushfires and floods and really intense periods. What we've indicated in March and what we've been undertaking in good faith regularly since is conversations with both those crossbenchers who signed up to that process, and we reported that to the wider Legislative Council members in our monthly reports, and we've been working through just what does a best practice pandemic specific set of powers based on what we've seen operate most effectively in comparable jurisdictions, and we'll work through those issues and we'll work through those, and once we've got a position that is in draft form, as we always do, we'll bring that to the Parliament and we'll bring that through all the consultations we have on any piece of legislation with specific sector players, and we will land this piece of legislation as we said we would in March.
One of the things the Greens are asking for is police to record the racial appearances of people they either pull over or that they fine. What's your view on that?
Oh, look, in good faith we are going through a whole series of conversations with the crossbench partners in this process, and I wouldn't predict where that would land until such time as those conversations have concluded. But what I can say is it is agreed position that we will land a pandemic specific set of powers as opposed to a much more generalist position of what a state of emergency set of powers, which might not be as nuanced and might not be as targeted as would be the case for pandemic response powers.
Is it a consideration at the moment to allow people who are fully vaccinated to avoid quarantine if they're travelling interstate?
So this issue comes up regularly, and one day we're going to have that conversation as a community, as a nation. And other countries are already having that conversation. But those countries are at 50, 60, 70% vaccination rates. We are just over 3% fully vaccinated. And what we need to do is have our focus on firstly keeping the virus at bay through dedicated risk-based quarantine facilities and keeping on top of outbreaks so as to make sure that if they occur, we get on top of them, but stop them occurring through those risk-based facilities, whether it be in hotel quarantine for low risk or broadacre fit-for-purpose facilities for higher risk returnees. That's the first bit. The second bit is having in place high levels of vaccination. Then, of course, we're all going to have the conversation about what does opening up look like, but we're nowhere near that point yet, and it's our focus to keep Victorians safe and to keep Victorians engaged in that process of staying on top of outbreaks and delivering high rates of vaccinations within the constraints of the Commonwealth supplies.
School holidays are... Oh, sorry.
Sorry, Rachel. Would you have a percentage of the population that you would be comfortable with?
Look, this issue has also come up quite a lot, and I'm not a vaccinologist or a epidemiologist, but the advice that we have received goes to it will depend. It will depend on how many people, at what risk profile, responding to what variants, and what other opportunities there are for ongoing vaccination programs to deal with those variants. So clearly, one day we will have that conversation, but we need to get over the hurdles of suitable quarantining facilities and high levels of vaccinations first.
School holidays are coming up in a fortnight. At the moment, the only state that Victorians can go to, and they're only allowed to go there for work purposes without quarantining, is New South Wales. WA's saying that it will have to have had 14 days with no community transmission in Victoria before it'll consider waiving that quarantine requirement. Should Victorians give up on having an interstate holiday if they've got one planned during the school holidays?
Well, I can't speak for interstate jurisdictions, and there are a range of different provisions that interstate jurisdictions provide, whether you're from regional rural Victoria or metropolitan Victoria. But what I know is that the sooner we drive this outbreak down to the point where interstate jurisdictions do not have those concerns, is the sooner we can get back to the kind of life that we were familiar with the 86 continuous days of no community transmission running into this outbreak.
Victoria has been consistently arguing, and you again said it today, that the only way out of this pandemic is through high vaccination rates and also a purpose-built quarantine facility. The model we have at the moment proposes 500 beds. So essentially that's 500 returning travellers who can quarantine there in a fortnight, given that they do need to quarantine there for a fortnight. Will the purpose-built quarantine facility actually go a long way to preventing outbreaks?
Samaya, that's the issue. It's not. These are risk-based additions to the hotel quarantine system, but they're risk-based and they are there to take the higher risk categories as we see variants of concern rage around the world. So in regards to that particular question, it's all in the mix, and it's a significant contribution to how we can open up safely. Ideally, it should have been built 12 months ago. It wasn't, and what we want to make sure is that it's built as soon as we possibly can get it built.
the hot hotels or the medi hotels, so those people who test positive, they're quarantining in,
Hospital hotels.
the hospital setting hotels. Will they be required to quarantine at the purpose-built facilities, because they're obviously the most at risk?
Well, we're working through all of those issues in the planning and development stage, but it'd be too early to say. At the moment, that with only hotel quarantine available, and hotels were good for tourists, not for quarantine, we've put in place as many of the risk mitigation measures as we possibly can. But there is no such thing as a no-risk hotel for quarantine purposes. Our hospital hotels have a higher level of infection prevention and control. They have a higher level of medical and clinical oversight, and they have a higher level of clinical engagement with people with COVID and other issues with their health, and that's to make sure that those really risky settings are as safe as they can be, but they are not no-risk settings.
And with those hot hotels, it's obviously going to take us a couple of months before we even start building and finish the construction of those facilities. Is there any reason why we can't replicate the hot hotel or the medi hotel settings in, so-called cold hotels?
If I understand the question, can we have more hospital hotels? Well, it's all based on what we see as the questions of demand within the caps that are in place through the Commonwealth, and at the moment that's working within the constructs of what we see as demand from the returnees internationally, and we've got no plans to expand beyond that current arrangement.
Would it be cheaper and also much more speedier to have all hotels with a hot hotel setting?
Would it be speedier and cheaper to have
all returning travellers quarantine as though they are COVID positive and have the same settings in place that hot hotels do?
Well, there's high levels of and increasing levels over time of infection prevention control and other measures in place in all quarantine hotels. There is an extra level, as I think is suitable, for hospital hotels. In terms of that specific question, I'm happy to get some clinical advice and some cost advice and get back to you.
The state government and City of Melbourne's Melbourne Money scheme has just got underway. That's the scheme that gives city diners a 20% discount on eating out at restaurants in the City of Melbourne. There's huge demand for dining in the city this weekend anyway, because people have just got out of lockdown and they can't travel further than 25 kilometres. Is it really a good use of taxpayers' money and ratepayers' money to be funding that at a time when people aren't even allowed to, you're making us wear masks outdoors, weddings are capped at 10 people, and in other settings you're really trying to discourage numbers of people? Is it a bit of a contradiction?
Oh, no, I don't think it's a contradiction at all. It's encouraging within the constraints that we're operating in, perfectly approved activity that brings activity back to the central business district, and I think that's a good thing.
How many of the active cases are serving their isolation at their own premises?
I might ask the COVID commander, but we of course offer, if people can't quarantine safely at their own premises, alternative premises for personal close contacts and those people who do test positive in the community to isolate appropriately. Together with support that we've had from the ADF and our authorised officers, we monitor that. We engage daily with people to make sure that they're both well and their welfare is being looked after whilst they continue to isolate, and we have very high levels of compliance. But in terms of the actual numbers, I think Jerome indicated, they continue to come down as the personal close contacts increasingly are cleared. But in terms of specifics, if we've got them, I might ask Jerome.
I'm just quickly going to say before you do that, can I just ask you one last one about the Pfizer vaccine? It's reported that it will soon be available to GPs. I know that's not under the state's jurisdiction, but do you have any indication of when that will be available to GPs? Will it happen this month?
Well, as you correctly forecast, these are matters for the Commonwealth, who supply the vaccine to both states, to their own private residential aged care and disability program, and to GPs. GPs continue to allocate the majority of vaccines nationally, as well as in Victoria. And that is a good thing, because they've been doing it for generations, and they have that direct relationship with their community and their patients. In terms of the Pfizer allocation, I think in particular that I saw a report, we welcome anything that gets more vaccinations of any type out to GPs to get into the arms of Victorians as quickly as possible. In terms of the specifics and the amounts, we haven't had that information shared with us. That's obviously between the GPs and the Commonwealth.
And very quickly also, have you got any reflections on the Premier's confirmation that he'll be returning to work a fortnight from tomorrow?
I welcome that. The Premier has had a pretty nasty injury, and with the support of his medical and physio and other supports, he's making a good solid recovery, and I really welcome the positive announcement he made last night, and I look forward to him coming back as soon as he's up to it, which, as you say, is 2 weeks.
As I count of the active cases, there are 3 people still in hospital. That number hasn't changed for, I think, over a week or so, and those 3 people are well, but being in hospital is the best place for them to be. There are quite a few individuals who are taking the option of going into the quarantine hotel. I don't have an exact number as we are today, but have to come back to you on that separately.
All good?
All good?
Thank you, everyone.
Thank you all.
See ya.